The Fishbone Diagram, or Ishikawa diagram, was developed by a quality management leader named Kaoru Ishikawa in the 1960s as a brainstorming tool to visualize the root cause of a problem. The root cause of the adverse event is the lack of knowledge regarding appropriate anticoagulant medication and dosage for older adult patients. Pradaxa is an anticoagulant that works as a direct thrombin inhibitor that is appropriate for adults. However, the risk for bleeding and stroke is increased in patients 75 years and older. The categories used to guide problem identification are people, equipment, processes, environment, materials, and management. The factors that influence this adverse event are people, management, resources, and processes. People include nurses, doctors, pharmacists, and patients. The doctor wrote the unsafe prescription for the patient. The pharmacist saw the prescription but did not realize that the drug was not safe for the intended patient. The nurse ultimately administered the medication to the patient. The patient had a lack of knowledge about the risk of taking Pradaxa for their age group. Management should provide training and education for staff to minimize the chances of an adverse event happening in the future. Management should have protocol in place that encourages staff to speak up when a medication seems unsafe and advocate for patient safety. A medication safety officer was not appointed, possibly because it takes too much time to do a medication review. Just culture is a shared model of accountability for management and staff. A just culture algorithm can be used to understand errors, determine their root causes, and decide the best way to manage them in the future. The resources a facility has can significantly impact the quality of patient care. The facility did not have a system in place that alerted the staff that a potentially unsafe medication was being prescribed, filled, and administered to the patient. The facility's safety officer could have been an effective leader in preventing adverse drug events. A medication safety officer was not appointed, possibly because conducting medication reviews is a time-consuming process.